I'm Dr. Khaled Khalaf, and this is Vital Heart and Vein. Medicine was always plan A for me. When I was a kid, to aspire to be a physician was a very noble thing at the time, and arguably it still is. The idea of helping people seemed very appealing, and I sort of gravitated towards the sciences in school. I tell everyone I was actually bred to be a cardiologist. Believe it or not, the title of my 5th grade science project was The Complications of Balloon Angioplasty, which I ended up getting a B+, and that's the first B I ever got. But I think the teacher, she just didn't get it. At the time, I borrowed a Brunwald's textbook, which was like the Bible of cardiology, from my uncle, Dr. Mazenganum. I think he was a fellow at the time. And just to see how much pride and joy he brought to the family, being the first physician, it really kept me inspired and paved the way to start a career in medicine, specifically in the field of cardiology. After high school, I was destined to play football for Rice University. I mean, that's what I thought. That's what my coaches thought. That's what my entire family thought. And when that didn't happen, I was pretty devastated, to say the least. But the Lord works in mysterious ways, and I ended up at the University of St. Thomas here in Houston, majored in biology, minored in philosophy. Later, I entered med school at the University of Texas in Houston in the medical center, completed 4 years of medical school, and I was fortunate enough to complete the entirety of my training in the medical center. So 3 years of internal medicine residency, an additional 3 years of general cardiology fellowship. My last year I was elected as chief fellow, and an additional year of interventional cardiology. It's a pretty long road, to say the least. It's a total of 11 years after college. It's like going to first grade all over again. And the beauty is I still practice out of the same hospital I trained out of. So to have that continued interaction with the staff and my mentors at a great academic institution is truly a blessing. Think of interventional cardiologists as plumbers. The most typical procedure we perform is percutaneous coronary intervention, whereby a stent is placed inside of the artery that supplies blood to the heart itself. The same concept applies to the legs, known as peripheral vascular disease, which is my favorite type of procedure, and it can be challenging at times, especially when dealing with 100% blockages. I'm also a vein specialist, and there are now novel technologies used to treat deep vein thrombosis or blood clots in the legs, which can travel to the lungs and cause a pulmonary embolism. I also specialize in superficial venous treatment, which can lead to varicose veins and the symptoms associated with venous reflux. The most complex procedure I perform is called TAVR, transcatheter aortic valve replacement. In a nutshell, TAVR is a way for us to replace a patient's failing aortic valve without having to undergo open heart surgery or even general anesthesia. It's done through small incisions in the groin, and the patients are typically discharged the next day. I was fortunate enough to train at one of the highest volume centers in the world for this particular procedure, and I'm very proud to have started the TAVR program at HCA Kingwood Hospital. Vital Heart and Vein is the largest cardiovascular multi-specialty group in the greater Houston area. Our main office is located in Humble, with 2 other locations in the Texas Medical Center and Pearland. With cutting-edge diagnostic testing and therapeutic interventions, we cover every specialty within cardiovascular medicine. This includes general, interventional, structural, and electrophysiology. Our team also consists of vein specialists, vascular surgeons, and even podiatry. The main office has a state-of-the-art outpatient-based cath lab and ambulatory surgical center where patients really get that VIP feel. We are here to serve our patients, and that's the bottom line, and that's what sets us apart. It's a privilege to be able to work with other family members, but everyone here is treated like family, from our staff to our colleagues, and especially our patients, whose trust in us is vital.